Hello, my name is Cassidy Klein, and today I'm going to be covering the topic Alzheimer's disease. Alzheimer's is a type of disease that affects parts of the brain, causing nerve cells, also known as neurons, to degenerate or become destroyed. Alzheimer's disease falls under the category of dementia. It is the most common cause of dementia, making up an estimated 60% and 80% of dementia cases. When the cells become damaged, it starts to affect cognitive function, interfering with the ability to think, the ability to learn, and memory recall. Alzheimer's disease falls under the category of degenerative disease, which means that it will become worse over time. After someone has had the disease for some time, it starts to affect parts of the brain that control basic bodily functions such as walking, eating, swallowing, talking, and so forth. Watching for symptoms of Alzheimer's can be difficult depending on the stage the disease is in. Some of the symptoms to watch out for if you suspect someone of having Alzheimer's is as follows. Forgetting recent conversations, short-term memory is affected the quickest with this disease. Forgetting about making it to events or appointment, misplacing or hiding an item such as car keys or a phone, struggling with tasks such as math, making decisions that one usually would not make. Another big symptom to look out for is personality changes. Changes to the brain will change the outcome of one's personality, causing them to have mood swings, losing trust in people they normally would trust, and finding themselves to act antisocially. Now that we have covered some of the symptoms, let's go over the stages of Alzheimer's disease. There are 7 stages of Alzheimer's disease. Stage 1 is before the symptoms appear. This stage is often called the preclinical stage, and it likely begins around 15 years before the first symptoms show. There is no treatment for this stage. Stage 2 is basic forgetfulness. Early stages of Alzheimer's can be mistaken for normal everyday forgetfulness. They will forget things such as where they misplaced their keys or forgetting someone's name. In this stage, they can still do normal everyday activities such as drive, work, and socializing. If this disease is caught in this stage, medicine may help slow down the progression. Stage 3 is noticeably memory loss and difficulties. In this stage, the person may have more difficulty remembering a name or a word, find remembering plans and organizing objects very difficult, or other noticeable memory problems that should not occur. Stage 4 is more than memory loss. This stage can last for years. In this stage, memories of past events in the early years of life are significantly better than the memories of current day. Patients in this stage also have trouble knowing what day it is and where they are, increased risk of wandering off or getting lost, and have major changes in step patterns and sleep patterns. Stage 5 is decreased independence. In this stage, the patient may have trouble remembering people who are close to them, such as family and friends, may have trouble dressing themselves, and experiencing hallucinations such as seeing things or people they have or not heard seen there. Stage 6 is severe symptoms. In this stage, the patient cannot live on their own. Communication can become difficult, such as understanding what they are trying to say or explain. Also in this stage, the person does not know what they are doing and may become frustrated. Stage 7 is the lack of physical control. This is the last stage of Alzheimer's, and in this stage, the body may begin to shut down. They will tend to have need around-clock care helping with everyday tasks such as eating, walking, and using the bathroom. In this stage, the body can become vulnerable to infections like pneumonia.